welcome to Healthy Talks. My name is Julie, and today we are with Dr. Carly Young-Bailie, who is a postdoctoral research fellow at the South African Tuberculosis Vaccine Initiative. Hi, Carly. How are you doing today?
Hi, Julie. I'm good. How are you?
I'm good. Thank you so much for taking the time out of your busy schedule to meet with us. We hope that our listeners get something really interesting out of this because you have this amazing career that you've done already, that you're in and that you're looking forward to. So we're really excited to have you on our show today.
Thanks so much for having me.
So, Carly, tell me, what initially sparked your interest in TB immunology and what continues to motivate your research today?
So, I guess we could maybe start at childhood. Ever since I was a child, I always knew I wanted to do something meaningful with my life. And although as a young girl, I never really knew exactly what that would look like, I guess I was always on the lookout for opportunities to change the world. And I think that's what led me into science until one day I stumbled upon an opportunity to study in a TB immunology research group for my master's degree. And that really was the start of my career. And so I was born and raised in South Africa, and I've always known that TB is a real problem, but I never truly understood how devastating the disease could be until I'd actually taken up the opportunity to study TB and learn how the immune system fights TB. And so that experience was an eye opener for me, and I became totally engrossed in the complexities of TB and how the immune response to the bacteria that causes it. So I think I fell in love with like the wonderful complexities and the challenges that really
Yes.
sparked a fire in me. And I realized I just wanted to learn more. So I think day to day, the journey of continuous discovery is like my day to day motivation. But at the heart of it all, it's probably the childhood dream of just wanting to make a difference and make a meaningful impact. And so my goal is to better understand TB with the hope that we can develop better interventions and strategies. And so even if my contributions help this much, a small contribution to help save the lives of others, that's, I think, what my major motivation is.
That's fantastic. And like I said, coming from childhood, you've had that sparked interest, and now you're actually doing it, and you definitely do have an impact on it. And tell me, what specific aspects of TB immunology are you currently researching, and how do clinical and immunological studies complement each other in this fight?
Okay, so at SATV, you already introduced us. We are the South African Tuberculosis Vaccine Initiative. We are a research group, and we're dedicated to the development of new and effective TB vaccines through cutting edge research. And so my specific research as a postdoc, we effort into that broader mission by trying to understand immunology and the immune response in human lymph nodes. And so I obtain human lymph nodes from people who have passed away, mainly due to trauma. And so my specific research, I look at the lymph nodes in two different groups. So we have individuals who died due to trauma, but who were otherwise healthy and living quite healthy lives. But then we have a second group of people who are individuals who died due to trauma, but at autopsy, we find that they had TB in their lungs. And so we compare these healthy people and the people with TB in their lungs. And by comparing this, we can better understand how the immune responds to TB within the tissues. And specifically, I look at lymph nodes because these are really important organs of the immune system, where the immune system is activated and primed to fight infections. So when we study immunology in the tissues, particularly the lymph nodes, it helps us to gain a more accurate insight or more accurate understanding of how the body combats TB, where the immune system is actually fighting and dealing with the infection. And to address your question about how clinical and immunology studies really complement each other, I guess I would say that clinical studies provide invaluable data on how TB manifests, how it spreads. It also gives important data on the efficacy of treatments and vaccines, and it can also
Mm.
help us understand the epidemiology. That's the clinical side. But then when we think about the immunology side, the immunology aspects and the study of the immunology helps us to really understand the mechanisms of how the body responds. And that's done at a cellular and a molecular level. So when we combine insights from clinical and immunology, we really develop this more comprehensive understanding of the disease. And so the one guides the other, essentially. So clinical
Mm.
data guides how immunology research should be done and highlights critical areas of importance that we should look at. But then immunology then provides insights on how we can put our findings into practice by finding, for example, biomarkers for early detections and ultimately therapies like disease. So essentially both of these aspects complement each other in accelerating development to fight TB.
That's amazing. That's really interesting to see how they work together to help fight this. Can you describe a breakthrough or a significant finding in your TB research that you are particularly proud of?
I guess maybe I could start by saying, for me, the most significant breakthrough in my field of research is bringing to the forefront the study of human tissues in TB. So traditionally, and this might actually be surprising to some people, but traditionally TB studies really focus on immune cells in the blood. And while the blood is very important to study and it does really give us some good insights, it's excuse me, it's not actually, TB is not actually a disease of the blood, it's a disease of the tissues. And so
Oh,
TB exists in the tissues. And so I'm extremely proud of the fact that we are now bringing tissue immunology studies to the forefront so we can study the disease, where it happens, and where it's interacting with the immune system. So we've shown that it's not only feasible, but we also get really insightful data from these tissues in individuals that have passed away. So like I said, this approach isn't very common, but we've shown that this kind of work can really open up new avenues for discovery, and super exciting doors have opened for our research. Yeah, and I guess then also at a more specific level, my research in the tissue, I'm using very new technologies to study the genetic signatures of immune cells in
yes.
the lymph nodes. And so I can't share exactly, it's unpublished, but we will be publishing soon. So I will be sharing some information on the genetic data of
Oh, wow.
these cells. So I guess I would say stay tuned and watch this space.
That's amazing. What were some of the biggest challenges you faced in your research in TB, and how did you approach overcoming them, particularly in clinical trials?
Yeah, so, okay, I guess at a complexity level, TB is a very complex disease itself. So from a
Yes.
technical aspect, it's hard and it's challenging to study TB from the get-go. We know that TB has a very unique way of evading the immune system. And so to understand these complexities, we continuously have to leverage new technologies and methodologies to improve accuracy, efficiency, and yeah, the impact of our research. But when we think about our research as well, especially in the clinical field, we have other challenges despite the technical, and those include dealing with the people that we have in our studies. So when, like I say, we're studying human tissues, and we
Mm.
get these from individuals who've passed away. And this presents logistical and ethical challenges because we get and handle tissues from an extremely sensitive situation that requires careful coordination and adherence to very, very, very strict ethical guidelines, because we have to approach families who are grieving, who have lost a loved one, and we have to ask them for their permission to include their loved ones or their deceased loved ones in our study. You mentioned clinical trials, and so although the tissue immunology study is not a clinical trial itself, it's a study, but we maintain the ethical and strict adherence to the standards of a clinical trial for that study.
Yes.
But at SATFI, we also are involved in vaccine clinical trials. And so, of course, that is also complex and has its own challenges because we have to recruit people, we have to recruit participants, we have to ensure that they adhere to the study protocols, we have to follow up with them, we have to ensure their safety. And so to overcome all of these different challenges, it's really important to adopt a very multidisciplinary approach. We have to collaborate very closely with clinicians, pathologists, ethics committees, community advisory boards, grief counselors, consenting specialists, and a whole bunch of other teams that ensure that our research is conducted to the highest standards of ethics, so that we can do our work effectively, safely, and ethically. I guess we also invest a lot in various community engagement projects, also to have significant community outreach and education initiatives. And this is also really important to build trust in the participants and their families so that they can understand the importance and trust us with their involvement in these kinds of trials and studies.
Enjoying this episode? Ever thought of starting your own podcast? Podup.com is your go-to. They've got everything you need to run a pro show, including 35 or more AI-powered tools for success. Sign up today for a free starter account and get 15% off with the code HealthETalks15. The code is HealthETalks15. Plus, check out podallies.com for a done-for-you podcasting experience, complete with website, social media, and editing. Start now and let's launch your podcast together.
And talking about communication, science communication is a significant part of your profile. How do you approach making complex scientific concepts about TB accessibility to a broader audience, and what strategies do you find most effective?
The concept of science communication and communicating these complex scientific ideas, it's a real passion of mine, but it is quite challenging. So first of all, when we think about science communication, the first approach is to break down the information into more simple and digestible terms. We, of course, have to avoid very technical scientific jargon and rather use analogies that people can relate to, in everyday experiences. And this, helps us to connect concepts with familiarity. And so the most effective approach really is storytelling, real life experiences.
Yes.
Of course, visual aids and videos are also quite engaging and impactful. But for me, and this is my ultimate, the best strategy is to actively engage with an audience through public speaking and through talks in our community outreach project. This allows for a two-way conversation to happen, and it is really crucial because it allows people to express their concerns and raise their questions. And in doing this, not only does the audience learn from the scientist learns from the audience. And so when we think of us as scientists, we have to really focus on understanding our audience's perspectives, understanding their questions, their concerns, sometimes understanding their misconceptions. All of this information it provides valuable insights, and it helps us to shape future research and communication strategies. And it also, I guess, fosters a more inclusive environment to build trust, awareness, and support for our initiatives.
And you mentioned that you were collaborating with other departments, which is very crucial in scientific research. Can you discuss how working with experts from various disciplines, such as epidemiology and public health, has enriched your research and its outcomes?
Yeah, so collaboration is one of the cornerstones of science. So we have to collaborate with experts from different disciplines. And by doing this, it provides diverse perspectives and expertise. You mentioned epidemiologists. These are incredibly important people who help us understand TB spread and risk factors. And this really helps guide our study design and focus areas. And then, of course, public health experts. They are so important because they offer insights into practical implications of our findings to ensure that our research really addresses real-world problems. As a scientist, there's so much we can do in the lab, but that's not really applicable in real life. And so we have to have that communication to ensure that what we do reaches and has the impact, the desired impact. We also rely heavily on working with other research groups in different countries, in different areas. This helps to make sure that we get people with different expertise, different resources, and it really just helps foster these mutually beneficial relationships to ensure that we have quality research and impactful research at the end of the day.
Amazing. And how do you see the role of immunology evolving in the fight against TB in the next decade?
Yeah, so in the next decade, I hope to see immunology research really take off with more studies in the tissue immunology aspect. Like I say, I'm very passionate about studying TB in the tissues. And so further to that, in the next decade, I would hope that these tissue immunology studies would help us to design more effective TB vaccines. And so, I guess that's where I hope to see the field progress.
And looking ahead, what are your aspirations for your career in TB and science communication? And what impact do you hope to achieve?
So the future is always uncertain, and I don't know where I will end up, and I'm not too sure what I would achieve. But I can say that one thing I am certain about is my passion for TB immunology and science communication. So I aspire to continue engaging in the dynamic field of TB research. I hope to continue pushing the boundaries of what we can do and what we can achieve. I aspire to continue to think differently and think innovatively about how new research can guide new strategies in our fights against TB. And of course, this also comes with the responsibility that we have as scientists to engage, educate, and enhance the understanding of our communities. So ultimately, my goal is to continue to make advancements in the area and inspire and educate other people while I'm at it.
Yes, definitely. And for our last question with you today, beyond TB, what do you think are the most pressing issues in global healthcare today, and how can the scientific community address them?
Okay, so beyond TB, wow. Global healthcare, we have obviously a lot of emerging infectious diseases. We also have the real big problem that we face of antibiotic resistance, and then of course access to equitable healthcare. I think those are the three things that I would say are of the most pressing concern. If we think about infectious diseases, everybody's familiar with COVID-19, and I think that really highlighted the important need for robust surveillance systems and rapid responses. And then I think if we think about antibiotic resistance, the emergence of continued resistance to antibiotics really undermines our effectiveness of current treatments, and it makes infections much harder to treat and control. And then, of course, the disparities in healthcare is devastating because we have huge disparities in our access to quality healthcare. And this means that populations around the world don't receive the medical care that they need and they should have a right to. So to address these things, I think I would highlight three important areas, which is collaboration, investment, and then equitable healthcare policies, I would say. So collaborative efforts, meaning that the world needs to get together and pool our resources, to collaborate and to really have a unified approach to these issues. And then in terms of investment, finance, we need financial investments, new resources to help us stay ahead of evolving pathogens and to help us discover these new interventions. And then I think for policies advocating for equitable healthcare, we need our advocates. We need people to fight for policies to ensure that we have access to healthcare and help to bridge that gap in between healthcare. And so I think if we address these issues and use our collaboration, investment, and advocacy, we could
Yes.
really make significant strides in global health.
Well, I hope that does happen. And I hope a podcast like this also gives that impact. And just even if it's like a little bit, like I say, even if it's a little bit of an impact, a little something can become a big something. So I really do
Agreed.
hope that our listeners out there has also learned a lot from TV like I have. But Dr. Collie, thank you so much for joining us today. We really do appreciate your input. And I hope that your career is just blooming for helping this research and fighting this disease.
Thank you so much. Thanks for having me today. I appreciate it.
And to all our listeners out there, remember to like and subscribe, and we will see you on the next episode of Healthy Talks.